Here is another example of the bare bones strategy for reading comprehension. And this particular page comes from, it was close by here. Here it is. In your textbook, it should be around page 688. It's talking about IBS, irritable bowel syndrome, and we're looking at this passage about pathophysiology. And I'm going to apply that same bare bones strategy that we used before. So remember, my first thing with bare bones are words that don't look like other words. And I see one immediately there with pathophysiology. The header is one such word. There are no bolded words in the passage. There are no italicized or underlined words. So I would move on to my next thing that I'm looking for. And that is going to be, remember in the last passage we marked numbers. So anywhere you see a number, I'm going to mark that and all the things associated with it. Now here's an example of a number that I would not mark. This is a citation of research that's been done. So Walden Lehrer are scientists or doctors, someone that's done research. I'm not going to mark those because they're not relevant to my passage. I also see IBS, that is an acronym. I always mark acronyms and make sure I know what they mean. There's IBS again, and there's GI. And then I'm going to go after those nouns. Now, if this were a passage that is describing activity of some kind, I would look for the verbs, the action words. But I'm looking at nouns here because this is an informational passage. So I see bowel pattern, abdominal pain, bloating, altered motility. We'll look at that word motility in just a minute. Intestines, bowel infection, intestinal cells, flora, abnormality of nerve function in the intestine. Then it talks about a chemical mediator, the word serotonin. That's a word I'm familiar with. There's bowel motility, visceral sensitivity, medications, treatment, that would be an important word, microscopic inflammation, and then the word therapy. I like that one. So I'm just picking out those medical words that are persons, places, or things. Again, I'm leaving out the authors of research because those are not relevant to my comprehension. So the first word that I'm going to tackle is the pathophysiology. Now, this particular book uses this term over and over. So probably by this point you already know what this word means. But if you don't, break it down. Figure it out. Physiology is, I guess you could say, the study or the branch of science that deals with normal function of organs, cells, organisms, the normal function of, I'm just going to use organs since that's what we're focused on here. Patho is disease. So this word, pathophysiology, makes me think that something about the function of the organs is no longer normal. It is diseased function of organs. So this is talking about an organ that is not functioning the way it should be. Okay, so I also see that with the word altered. Altered means changed. And they use that word over and over. Here's another one, altered motility. Motility means movement to me. That may not be the best way to describe it, but to me that's what it means. So we're talking about bowel patterns, altered motility of the intestines. So this is related to the movement of bowels. It's related to the process that your body does to rid waste, solid waste. So that helps me. At least I know that we're talking about some unnatural process with bowel movement, with the movement of food, of waste through your intestines. Okay, so then I see this word IBS. I know what that means, irritable bowel syndrome. GI is gastrointestinal. So just make sure that you know what the acronyms mean. Flora refers to the growth of plant life or bacterial life. Flora is bacterial growth with respect to the intestines. I know that word. I see abnormal nerve function. And then it gets into this really hard to read stuff. Okay? We have this sentence that starts right here. The chemical mediator 5-hydroxytryptamine, or 5-HT. I have no idea what that is. But look at this. Or serotonin. I know what serotonin is. Serotonin is that neurotransmitter boosting drug that helps with nerve cell movement. If you don't know what serotonin is, stop and Google it. Look it up because that's critical to understanding this process. So serotonin plays a role in bowel movements and visceral sensitivity. Okay, this word visceral, I'm going to show you how to look that one up. I know what it means to me, but I'm not sure that I have the right meaning. So I'm going to go to Google, and I was going to show you on physiology, but that one I think we know. So let's look up one that's not as common. So visceral is the word. And I want to know the definition of visceral. Okay, this is what I would have said relating to the viscera, but that's really not helping me. I mean, viscera I still don't know what the word means by looking at this. It also relates to deep inward feelings rather than to the cognition, the intellect. But I'm looking at this in medical terms. The visceral nervous system. That's not helping me. So let's look at this for the visceral definition medical. Let's isolate it down. Here we go. Having to do with the viscera, which are the soft internal organs of the body. So it relates to those internal organs. The inside of internal organs is how I would have described it. I'm still not sure my definition's the best. But the point is, I stopped and I looked it up. I need to know what the word means. Okay, so then it talks about medications altering that serotonin derivative, I'm assuming, 5-HT3 and 5-HT4. I don't need to know what those mean at this point. That is not critical to my understanding this passage. Okay, so I am ready to put this in my own words. And this one's a little tougher, I'll tell you. The last one came easier for me. So let's see what we can do here. And I have to shrink this to be able to use my Post-it, but I think this will do. Okay, so we know that we're talking about some sort of abnormal organ function, and we know that we're talking about the bowels. We know that we're talking about IBS. So I'm going to just do that. I'm going to write IBS here. That is a disorder of the bowels. We can agree on that one. Okay, we're talking about altered or changed bowel movement. Now, we can use the word motility, but that's a word that's hard for me to remember or whatever. I'm just going to put it in plain terms. IBS can follow a bowel infection. It's possibly related to changes in intestinal cells or flora, the bacteria balance. Possibly. We don't know. It just says it may be. We know that there is evidence that IBS is linked to abnormal nerve function, which ties into that concept of serotonin, because I know that serotonin plays a role in nerve function. You have to sort of think outside the box. The book is not going to just tell you word for word. They want you to make connections. So, abnormal nerve activity or nerve function, let's just use their word. I'm not even going to list those big chemical names. I am going to put the link with serotonin here, because that could be a test question. Which of these drugs is related to the study of IBS? They could list serotonin because it acts on the nerves. It acts on bowel movements and the sensitivity of those internal organs. Medications that alter serotonin activity have been used in treatment of IBS. Microscopic inflammation has been identified in patients and is possibly going to explain some of the IBS mystery. So we could say that microscopic, which means too small to be seen with the eye. I would suspect this is at the cellular level, maybe, if it's that small. And again, this is still in the investigative stages, so I'm going to put a question mark there. For me personally, this would be enough to comprehend this paragraph. I'll say it this way. This is about all I can get out of this paragraph personally. Now, others who read better than I do or have better skills with this may be able to pull out far more detail. But this particular post-it note for me is complete. So you see that the post-it notes are carrying the main ideas of those paragraphs. And when I used this method, I still use this method if I have to study for a test. The night before my test, the last thing I do before I close up shop for the night, I read my post-it notes. I go back through the text, wherever I've used those notes, I'll look back at the main ideas on those notes, because the bare bones of those paragraphs become the notes, and that becomes my comprehension. I'm not going to tell you that this process is fast. It is not easy, but it gets better with practice. If you consistently use these skills, you will get faster and better at doing the bare bones strategy.